Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo once again. Doctor, how are you?
Very good, Luis. And how are you?
I'm doing great. After a long week of work, I'm feeling pretty good on this weekend.
I'm glad to hear.
So, Doctor, I believe we do have a very interesting topic this week because, COVID is still around. It's COVID-19. We all know it's a very complicated disease in this case or illness. And we have actually some post-COVID issues after we got COVID. And I believe stem cells can help with these issues, right, Doctor?
Yes, Luis. We're finding that there is quite a significant sequela post-COVID with many patients. So it can be minor sequela, and by sequela, I mean just sort of secondary effects. They can be minor and in some cases quite severe with organ damage, and so on and so forth, involving the lungs, the heart, kidneys, liver, and it's all due to basically hypoxia of the organs. And so we are finding that post-COVID stem cells are helping a lot in order to regenerate the damage caused by hypoxia or low oxygen to the organs during COVID, which is one of the major risk factors. So we're finding that the stem cells, as we know from past podcasts, they help regenerate tissues, damaged tissues. And with COVID, the secondary effects are damage to the organs and to the cells of different organs and tissues. So the stem cells are very, very helpful in reversing that damage post-COVID.
So, for people that doesn't know, what organs are actually damaged by COVID? Mostly damaged by COVID.
Right. So primarily the lungs, right? We see scarring in the lungs.
Yes, of course.
That's like number one. That's probably the most common. And then because of the hypoxia or low oxygen in the blood due to damage to the red blood cells and so on, we see the heart, we see damage to the heart, we see a lot of kidney damage, we see a lot of liver damage, even cognitive brain decline or brain damage. I don't want to say brain damage because we usually consider that to be pretty severe, but yes, the brain is affected because of the hypoxia. So a lot of our patients complain about problems with concentration, memory, also that chronic fatigue that goes along with COVID, and it seems to be a huge sequela post-COVID as well. And that's due to oxygen issues, blood cell issues, and anemia, which is low iron. So we address all of these aspects in the complementary and comprehensive.
And I want to ask you something else, Doctor. I think most of us already had COVID. Did you get COVID yet?
Yes,
Oh, you
I
did.
sure did.
Yeah.
I was blessed actually because I had COVID early on. I had it in November of 2020, and that was pre-vaccine. And for me, it was quite. I was happy to note that it was very minor, not so severe, and with just a little achiness for a day, but more of the fatigue.
So you got the right antibodies, the right ones.
Yeah, I was lucky because I was 8 months post COVID for me. I was still immune when the rest of my family was infected.
Wow.
I was still immune, and that was still pre-vaccine. So I've been lucky, and I practice what I preach. I do I do everything that we talk about in these podcasts. So
Hmm.
it definitely works.
All right. So back to my question: how can the stem cells actually help these organs that you mentioned at the beginning?
Right. So, that's a really important question because, we talk about general regeneration of cells,
Hmm.
and I want to explain again how what happens when the cells are placed into the bloodstream, so intravenously. So, of course, as we know, the blood flows throughout the entire body to all of our organs, tissues, brain, everywhere. So once we place the stem cells into the blood, the stem cells they hone in on where the damage is, because when especially when there's a recent damage to an organ or a tissue, because what happens is the cells are broken in the damage, and those specific cells of a specific organ release something called cytokines, or inflammatory markers. And again, those inflammatory markers are specific for that organ. And so when the stem cells are floating around, they hone into where that damage is because of those cytokines. Okay, they have receptors for these cytokines, and and then we get regeneration. The stem cells hone into those damaged tissues, and that's number one. And then another thing that we do is we also apply the stem cells locally. So we put them closer to the organ itself, and we do, if we see a lot of cognitive decline, and that's a major symptom or post-COVID sequela, we will also do an intranasal aspiration of the stem cells so that the stem cells can pass the blood-brain barrier and go directly to the brain. And in some cases, we may do intrathecal deployment of the stem cells, which is into the cerebrospinal fluid, which is for more severe cognitive decline, and so on and so forth.
And I need to ask you this because actually, my sister is having like a sequela after COVID, but her problem is hair
Mm,
loss. She's suffering hair loss
mhm,
because
mhm,
of
mhm.
COVID 19. So of course, I suggested the stem cells, but is that actually a sequela from COVID? Because she affirms that it's
Yeah,
because of COVID.
yeah. Sorry, Louise, I didn't mean to cut you off.
No.
But I get excited about that because it
Uh,
definitely is. We have seen that to be a sequela post-COVID in many, many, many patients. In fact, I suffered the same. It was a minor hair loss, but I suffered the same. And the reason for that, there's a kind of a twofold reason for that, is that we do see anemia post-COVID because of the damage to red blood cells. So anemia is a low iron, and we can low iron can definitely result in hair loss. Okay, number one. Number two, it is also can be due to the hypoxia, and again, just not enough oxygen in the system for that period of time, and then we tend to lose hair, and we have seen great results with post COVID stem cell, either directly and locally into the scalp, and also IV, and that would be combined with platelet lysate, which really helps in combination with the growth factors.
So also, doctor, the joints seem to degenerate after COVID. Is that right? Can stem cells help to relieve the pain on the joints?
Yes, what we do for that is we apply the stem as well for that degeneration. And yeah, unfortunately, COVID seems to be so widespread throughout the body and have so many different effects, and create so many different symptoms. And then again, and the damage that's done, um, it's so long lasting and in many cases permanent. So we do see this degeneration of the joints and the cartilage, and other connective tissues. And again, what we do is we place the stem cells right into the joint in order to help the regeneration process of those damaged joints.
Can I ask you if treatments are for young kids as well that had
Yes,
suffered COVID?
yes. We treat children all the time, and we do exactly what needs to be done. As we haven't seen very many severe cases of post-COVID sequelae in children, but definitely there have been cases that we've treated with great success, and children seem to bounce back so quickly with stem cells and any kind of regenerative treatment. But yes, we treat a lot of children for many things, not just post-COVID sequela.
So, doctor, what's actually involved in this stem cell treatment? Because you don't only deploy these cells, right? You actually do, it's like a big combo that you do.
That's right. That's right. Yeah, we comprehensive, as I've talked about in our past podcasts. So the first step is for us to take a really thorough history of what's going on. We do some blood screening and blood tests in order to see, okay, if there's hair loss, is it due to anemia or low iron? Is it due to low red blood cells? What's going on? Right. And that's just an example. So we do want to see all kinds of different blood tests and take a very thorough history. And then once the patient is approved for stem cell treatment, we will start a pre-treatment protocol, which will entail some key supplements and some key dietary changes, very sustainable, nothing that would be night and day for a patient where it wouldn't be sustainable. And yeah, just certain key factors that we add to their lifestyle also in order to get them in the best possible shape for the stem cell, not only to receive the stem cells, but also if we do an autologous treatment, which is the patient's own stem cells, we want to ensure that the stem cells are in the best possible condition. So that's number one. And then once the patient gets to our clinic, we will do a total detox program, which involves a nutritional IV with antioxidants, a very potent one, and 4 nights of an organic suppository. And this is all to sort of liver cleanse, as well as intramuscular B vitamin shots. And then we also start the patient with growth hormone therapy if we find that it's appropriate for that patient, as well as oxygen therapy, which is again so important with COVID, because as we know, a lot of the sequelae is due to not enough oxygen in the system. So we do oxygen therapy as well as a stem cell enhancement formula, which is a combination of key minerals and herbs that, again, sort of just fortify the body and also help the stem cells to keep humming and active and healthy.
Okay, so there you have it, folks. You can actually reverse the damage on those organs. And yeah, stem cells are a wonderful thing that was discovered to regenerate the organs and the damaged tissues. And well, the doctor is a specialized doctor that does this you've been doing it for quite some time, right, doctor?
Yes, since 2001.
Wow.
Yes.
Yeah. So it's been a long time, almost my age.
Yes.
I'm kidding. I'm not that young. So, doctor, would you like to add anything else to this podcast?
No, I think we've covered a lot of ground, Luis. And thank you for having me. And I'll let you do that last part, okay?
All right. So by the end of this podcast, you will find all the information and how you can reach us and how you can actually reach Dr. Sarah Figueredo. And if in case you have any questions, because of course you may have some questions regarding the stem cells treatments, you can actually write directly to the doctor and she'll be more than happy to answer those emails. Thank you, everybody. Let's see you next week. Bye.
Thank you so much, Luis. You enjoy the rest of your day.
You too, doctor. You take care. Bye-bye.
Thank you.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo, that is on YouTube. Thank you.